Hello YouTube, I'm Dr. Fox. Today, I'm talking about how much you should eat during pregnancy. Consuming a healthy diet and having an appetite calorie intake are crucial to making sure your baby develops in a healthy manner. A number of factors impact on what your best approach to diet should be, including your weight and age, together with any speed of weight gain. During the first trimester, most cases do not see women needing to up their calorie intake, which may also become the case in the final few weeks. Consult your medical professional, especially if you are worried you are not putting on the appropriate weight or too much. Your doctor may be able to tell you whether more or less calories are required. Each woman's needs are different. Your needs depend on if you are underweight, overweight, or obese before you became pregnant, or if you are having more than one baby. Choose a variety of fruits, vegetables, whole grains, and low-fat dairy products to help ensure the developing fetus gets all the nutrients it needs. Drinking water throughout your pregnancy is also crucial. Okay, you may be wondering what kinds of food should you eat. Foods that are high in nutrients should be selected, with dietitians favoring the following things: fruit and vegetables because of the fiber and vitamins; whole grain food such as bread and brown rice, which is rich in both fiber and vitamin B; dairy products that are low in fat or contain calcium or vitamin D, while rice, almond, and soy drinks are also ideal for pregnancy. Unsalted nuts and seeds are also an ideal source of protein, providing you eat them in small amounts, with other great sources being peas, beans, lean meats, eggs, and seafood. The advice is to consume around 8 to 12 ounces a week. A focus on healthy eating can also mean reducing your intake of salt and sugar, while unhealthy solid fat such as that in butter should not be consumed in great quantity. Okay, consider including many fruits in your diet, which are often overlooked, with other excellent choices including low-fat yogurt, vegetables, and lean chicken breast, all of which you can work into your daily diet. Don't be afraid to ask your doctor or discuss with a loved one. Okay, then, is it a problem to be a vegetarian? A vegetarian's diet can indeed suit a pregnant woman. However, you should consult your doctor to make sure certain nutrients are included in case your diet overlooks certain vitamins, iron, proteins, or calcium. If your professional has concerns, they can forward you to a professional dietitian who will be able to work with you on meal planning throughout your trimesters. Additionally, you may be advised on taking certain over-the-counter vitamins and minerals that suit your baby's development but might be lacking from your current intake. Okay, next question. Does pregnancy mean specialized nutrition needs? Undoubtedly, as pregnant women require more of certain vitamins and minerals, with iron, calcium, and folate being especially important. Folate, which is a vitamin B, is known as folic acid, may help prevent birth defects. Before pregnancy, you need 400 micrograms per day. During pregnancy and when breastfeeding, you need 600 micrograms per day from foods and vitamins. Certain foods that are high in folic acid include fortified bread and many breakfast cereals, spinach, beans, broccoli, strawberries, and orange juice. Typically, medical advice directs mothers to take perinatal vitamins on a daily basis, but make sure you ask your doctor rather than just bluffing ahead. Okay, as for folic acid intake, your standard folic acid intake should be at 400 micrograms a day, which can be guaranteed by purchasing a supplement. The likelihood of neural tube defects decreases thanks to folic acid in your system, so check out the foodstuffs available in your part of the world and incorporate them. Folate itself differs slightly from folic acid, not being absorbed as well by your body but still beneficial, found in orange juice and several green vegetables. However, it can be challenging to obtain all the necessary folic acid from diet alone, meaning a 400 microgram supplement may be advised. Mothers who have already had a child with neural tube defects are advised to take larger doses, even when they are only trying to get pregnant and particularly during the first trimester. Okay, next. Make sure to ask about iron and B12 if they don't mention them. A common challenge many mothers come to face is iron deficiency or anemia. Low birth weight can often be a consequence of insufficient iron, as can preterm birth. If your doctor finds that you're iron deficient, then they will provide you with a suitable supplement. Additionally, a B12 supplement is likely to be provided to vegans, though vegetarians can usually get enough iron via dairy products. Okay, next. What other new eating habits may help my weight gain? Being pregnant can often mean monitoring your diet closely and figuring out what is best for you that may not have been the case previously. Okay, first thing, do not overlook breakfast. Mornings may be challenging for pregnant women, especially where sickness is involved. Some good advice is to take whole grain crackers or dry whole wheat toast to bed with you and eat as soon as you wake. This does not mean overlooking your typical breakfasts, cereal, yogurt, fruit, milk, etc. once you're actually out of bed. Okay, second thing, eat high fiber foods. A combination of high fiber intake, water intake, and physical exercise can safeguard against developing constipation. Various fruits and vegetables are important in this respect, as well as whole grain cereals. Okay, last thing, if you have heartburn, eat small meals more often. The best approach to heartburn is to spread out your diet. Eat regularly but slowly, enjoying small meals and avoiding spicy foods. Drinking separately rather than during meals can also help, and avoid lying down straight afterwards. Okay, next, what foods should you avoid? Some foods and drink can prove problematic if you have too much of them during pregnancy. Some examples your baby might not appreciate include the following things. First, alcohol and caffeine. Do not drink alcohol like wine or beer. Enjoy decaf coffee or tea, non-sugar sweetened drinks, or water with a dash of juice. Avoid diet drinks and drinks with caffeine. Second, fish and high mercury levels. Mercury builds up in some fish to an extent that can harm a baby. You should eat 8 to 12 ounces of seafood per week, but limit white tuna to 6 ounces per week. Do not eat tilefish, shark, swordfish, and king mackerel. Okay, last, anything that is not food. Other dietary additions women may wish to include are clay or laundry starch. These may be signs that your body is lacking in key nutrients. Consult your medical professional who can help to find the alternative that answers this craving. Other examples to avoid include undercooked meat, dairy meat, cheese that is unpasteurized, and raw fish. Check labels with cheese and dairy products or do some online research. Eating fish and exactly how much of it is healthy is often a question that pregnant women want answering. Certain fish contain methyl mercury when certain bacteria cause a chemical change in methyl mercury. Methyl mercury is found in foods that fish eat, and it remains in the fish's body after it is eaten. Rather than the fish itself, methyl mercury comes from the diet of the fish but can be transferred to humans and impact on a baby's nervous system. Experts tend to advise pregnant women can eat up to 12 ounces a week of fish and shellfish that have low levels of methyl mercury. including salmon, canned tuna, and shrimp. Albacore or white tuna has more methylmercury than canned tuna. Pregnant women should consume 6 ounces or less in a week. Avoid fish with high levels of methylmercury, including swordfish, king mackerel, and shark. Okay, as for caffeine, some studies suggest that too much caffeine can increase the risk of miscarriage. Consult your doctor regarding how much tea or coffee you drink, as well as sugary drinks like Coke, which can contain lots of caffeine. Certain limitations will be advised if not cutting caffeine out of your diet altogether. Plus, caffeine can also be lurking in some foods, with chocolate being an obvious example. Your healthcare provider might suggest a limit of 200 mg per day. Okay, my last advice is to get regular dental checkups. Your gums are more likely to become inflamed or infected because of hormonal changes and increased blood flow during pregnancy. Your dentist should be informed of your pregnancy, even if you are still in the early stages, while the next 9 months will also be a good time for regular checkup and blushing. Thank you for watching. See you soon.